Hello, everyone. Welcome back to Axon Health. Today, we are going to talk about something really important, something I believe drains the medical system a lot. No matter how you look at it, you're always going to have a pro and con to the medical or the healthcare system. You can either have a socialistic healthcare system where the money comes out of your taxes, or you can have high premiums where it doesn't come out of your taxes and then the system gets drained in certain ways because people don't follow protocols or understand clinical guidelines. And I mean anyone who has the ability or scope to shoot images or order them. So medical doctors, chiropractors, DOs, which are still medical doctors, and so forth. So what does the guidelines say for imaging? Let's talk about radiographs. So x-rays. What are x-rays for? X-rays are for typically looking at bone pathology. You can see some other things in there if you're really good and know your stuff. If you're a clinical radiologist, or this is what you do, or you're a DAC bar and you just look at imaging all day long. You can have tail signs for other types of pathologies, but soft tissue stuff, abscesses, so on and so forth, MRIs, gold standard, and then CT scans are emergency standards. So when you go to the hospital in a trauma accident, maybe if you have a subdural hematoma and they want to make sure you don't have a brain bleed, you get a CT scan because it's like that, automatic. If anyone has had an MRI before, it takes a little bit longer. But the MRI is the gold standard. So what does the research say about radiographs? And we're going to kind of use this towards low back pain specifically. There was a study that was done. The evidence-based chiropractor mentioned it. It was a 20-year study looking at primary care doctors, and they found that 1 in 4 shot a lumbar radiograph. Now, the biggest misconception in all of imaging is this: I shoot imaging to look. No, that is not correct. You shoot imaging to confirm what your other diagnostic tools point you in that direction. Also, if it's going to change your treatment protocol. So what happens in a system where people are gung-ho and they shoot imaging all the time? You completely drain the medical system. You also add cost to the insurance companies. You also potentially add cost to the patients when they don't need it. So let me give you an MRI example. Patient comes in, having some ridiculous symptomatology, goes past their knees down to their toes. You do some orthopedic examination, ranges of motion, other things, MRSs, muscle reflexes sensory, and you realize that you think that they have lateral stenosis of L4, L5. Okay. Do you shoot imaging or not? No. Most people would, and I'll tell you why. MRIs are used after 4 to 6 weeks of failed conservative care, and if it's going to change your treatment, and if it's progressively getting worse in the neurological symptomatology, MRSs, muscle reflex sensory. So most people that get MRIs do not need them, because you getting an MRI and it's showing that you have a disc herniation does not change the treatment. We already know what the research says. Spinal manipulation can help. Stability exercises for core, spinal decompression, opening up the canal and stuff like that. And then obviously surgical intervention, whether it be a discectomy, if it's a disc problem, or laminectomy, or any kind of decompressing surgery, is meant for when all forms of conservative care have failed. But the problem is, do you need it if you already know what the evidence is in favor for? No. And radiographs are used even worse. Now, I'm going to light up the room a little bit when I say this. I do not think chiropractors need to shoot imaging on 95% of people. They don't. Some chiropractic techniques use radiograph. That's their that's what they want to do. Do I think that's founded in the literature? I don't at all. And that's okay. We don't have to agree on everything. Some people do it and they know way more about it towards their technique than I do. Very specific spinal manipulations towards certain segments that might show certain things, excuse me, on radiographs. But MRIs are used so they're just used in ways that clinical guidelines are not used. So remember, 4 to 6 weeks of failed conservative care if it's going to change your treatment and if the patient is progressively getting worse with neurological symptoms, having decreased, hey, Dr. Pinella, I don't feel this after we've been doing conservative care. Hey, Dr. Pinella, my patellar reflex is not active, it's hypoactive. And so forth. Those are when you shoot and you already have in mind what you think is going on. Shooting x-rays to look and guess is absolutely terrible practice. Whether you're a chiropractor, medical doctor, orthopedic surgeon, neurologist, that is poor practice and you're doing a disservice to your patients and the medical system that you care so much about. So I'm very passionate about this. We have guidelines for a reason. We have the Canadian Cervical Spine Series, which is amazing. You can look them up, Canadian Cervical Spine Series, and look for yourself if you're shooting images or if you're wondering if you should have images shot on yourself and say, well, wait a second. I don't follow these guidelines at all. Why did my practitioner shoot all these images on me? It's because they're not following best practice. And again, that's what they want to do. That's not how I roll. It's not how my wife rolls. 80% of low back pain is non-specific, 60 to 80%. So if it's non-specific low back pain and there's no structural or tissue pathology, what's going on? Is it the fear avoidance cycle? Does the x-rays or MRI imaging at all tell you anything different? No. This is why clinical diagnostic criteria and you being a practitioner with good anything, orthopedic examinations and understanding them, what they are used for, the MRSs again, muscle reflex sensory, and so forth. This is what is used to determine if you need imaging, not to look. And there are some very mainstream doctors out there in all professions that shoot to look. Not good. Not a good enough excuse. It's just not. And no clinical guidelines support that at all. So, if I was an attorney and went to court, and I would destroy these people because it's just the way it is. You don't have to get your imaging taken when you don't need it. Non-specific low back pain, if you're not having, right now I believe it's 1 to 3% have insidious causes of low back pain. So, whether it's a AAA or an abscess or cancer, and you do your orthopedic examinations or your pulse and your blood pressure, and you say something is not adding up. This is what I think is going on. This is why I'm shooting x-rays or imaging, advanced imaging. Not, I'm going to shoot an MRI just to see. No. So I hope this helped a little bit. I know I got a little bit heated here. I think it's very important. Again, this isn't just because of the practitioner or money towards the patient. It's also bleeding the medical system dry, and it's also why your premiums are so high for a lot of other reasons, but it adds to it. It's a multifactorial approach, obviously. There's many reasons why the healthcare system, when it's not socialistic, has its downfalls, but also has good things about it. So, like everything in life. But again, most things, primary care for nonspecific low back pain, most people don't need that imaging taking. MRI, like I said, failed 4 to 6 weeks of conservative care with progression of neurologic symptoms and change of treatment plan. So I hope you guys enjoy. Thanks for listening and have a good day, guys.